I need to share a critical, often overlooked sleep habit that could be quietly impacting your health every single night. Most of us think about sleep in terms of how many hours we get, or whether we wake up feeling refreshed. But there's another factor that's just as important, and it's one that rarely gets the attention it deserves. This is something my colleagues and I, as sleep health professionals, have noticed time and again in our patients, especially among women as they age. It's a silent, modifiable risk factor that could be affecting your well-being in ways you might not even realize. When we talk about sleep health, most people focus on the basics: getting enough rest, sticking to a routine, and maybe even using sleep trackers. But what if I told you that the way you position your body during sleep could be just as important as the number of hours you spend in bed? In fact, your sleep position can influence everything from your digestion to your heart health and even your risk for certain chronic conditions. This is particularly true for women, who may experience changes in their bodies and sleep patterns as they get older. As a result, the risks associated with certain sleep positions can become even more pronounced over time. It's not just about how long you sleep, but how you sleep. The position you choose each night can have a direct impact on your body's ability to function properly. For example, sleeping on your back might help with spinal alignment, but it can also worsen snoring or sleep apnea for some people. Sleeping on your stomach can put strain on your neck and lower back. But there's one position in particular that deserves special attention, especially if you have certain health conditions. The position I'm referring to is sleeping exclusively on your right side. While this might feel comfortable or even be a habit you've had for years, it can pose hidden dangers, especially if you have untreated acid reflux or sleep apnea. When you sleep on your right side, gravity can actually make it easier for stomach acid to flow back up into your esophagus, increasing the risk of nighttime heartburn and long-term damage to your digestive tract. For those with sleep apnea, right-side sleeping can sometimes worsen airway collapse, making it harder to breathe and reducing the quality of your sleep. Over time, these issues can contribute to more serious health problems, including increased risk for heart disease and cognitive decline. That's why it's so important to pay attention not just to how much you sleep, but to the position you choose each night. By making a simple change, you could significantly improve your sleep quality and protect your long-term health. When we talk about sleep positions and their impact on health, especially from a cardiology and neurology perspective, it's not just a matter of comfort or habit. There are real physiological reasons why doctors pay close attention to how you sleep, particularly if you have underlying health conditions or risk factors. The way you position your body during sleep can influence the function of your heart, lungs, digestive system, and even your brain. This is why, in both cardiology and neurology, we often ask patients about their sleep habits, and why we sometimes recommend specific positions to help manage or prevent certain conditions. Let's take a closer look at what's actually happening inside your body when you lie on your right side, and why this position can be a concern for some people. Anatomically, when you lie on your right side, your heart and stomach shift slightly due to gravity, and the way your organs are suspended within your chest and abdomen. The heart, which sits slightly to the left of your midline, can be compressed or shifted in a way that changes how blood flows through its chambers. At the same time, your stomach, which is also positioned on the left side of your body, can allow acid and digestive contents to move more easily toward the esophagus, especially if the lower esophageal sphincter, the valve that separates the stomach from the esophagus, is weak or relaxed. These anatomical changes might seem minor, but over the course of a night, and especially over years of sleeping in the same position, they can have significant effects on your health. One of the most important concerns for people who sleep on their right side is the potential impact on breathing, particularly for those with sleep apnea, a condition that is often undiagnosed, especially in women. Sleep apnea occurs when the airway becomes partially or completely blocked during sleep, leading to pauses in breathing and drops in blood oxygen levels. When you lie on your right side, the shape of your airway can change, making it more likely for the soft tissues in your throat to collapse and block airflow. This is especially true if you have even mild, undiagnosed sleep apnea, which is more common than many people realize. The result is that you may experience more frequent and severe drops in blood oxygen levels throughout the night, even if you don't fully wake up or remember struggling to breathe. These repeated episodes of low oxygen, known as hypoxic events, are not just uncomfortable. They're dangerous. Every time your oxygen levels drop, your body responds by releasing stress hormones like adrenaline, which cause your heart to beat faster and your blood pressure to spike. Over time, This constant stress on your cardiovascular system can lead to inflammation in the blood vessels, making them more prone to damage and plaque buildup. This is a direct pathway to developing atrial fibrillation, or AFib, which is an irregular heart rhythm that can cause blood to pool and form clots in the heart. If one of these clots travels to the brain, it can block a blood vessel and cause a stroke. This is why sleep apnea is considered a major risk factor for both heart disease and stroke, and why doctors are so concerned about sleep position in people who may be at risk. In the clinic, we often see patients who have high blood pressure or unexplained heart rhythm problems, and one of the first things we ask about is their sleep. Many people are surprised to learn that their sleep position could be contributing to their symptoms. For example, if you have undiagnosed sleep apnea and you sleep on your right side, you may be putting extra stress on your heart every night without realizing it. Over time, this can lead to chronic high blood pressure, increased inflammation, and a higher risk of developing serious conditions like atrial fibrillation or even heart failure. The link between sleep position, breathing, and heart health is well established in medical research, and it's something we take very seriously in both cardiology and neurology. But it's not just the heart and lungs that are affected by sleeping on your right side. For many women, especially those who experience acid reflux or gastroesophageal reflux disease, GERD, this position can make symptoms worse. When you lie on your right side, gravity allows stomach acid to flow more easily toward the esophagus, where it can irritate the lining and cause that familiar burning sensation known as heartburn. Even if you don't feel classic heartburn symptoms, you may still be experiencing subtle reflux that can damage the esophagus over time. This is particularly important for women, who are often underdiagnosed when it comes to acid reflux, and may not realize that their sleep position is contributing to their symptoms. Acid reflux is more than just an annoyance. It can have serious consequences for your overall health. When stomach acid repeatedly comes into contact with the lower esophageal sphincter, it can weaken this important valve, making it even easier for acid to escape from the stomach in the future. Over time, this can lead to chronic inflammation of the esophagus, a condition known as esophagitis, which increases the risk of developing precancerous changes or even esophageal cancer. For women, who may already be at higher risk for certain digestive issues, sleeping on the right side can make these problems worse, especially if they go unrecognized or untreated. But the effects of acid reflux don't stop at the digestive system. There's a fascinating connection between the gut and the heart that involves the vagus nerve, a long, wandering nerve that runs from the brainstem down through the neck and into the chest and abdomen. The vagus nerve helps regulate many important functions, including heart rate, digestion, and even mood. When acid reflux irritates the esophagus, it can stimulate the vagus nerve, triggering a reflex that affects the heart. In some people, this can cause abnormal heart rhythms, such as atrial fibrillation, especially during sleep when the body is more sensitive to these signals. The vagus nerve acts as a communication superhighway between your gut, heart, and brain. When it's triggered by acid reflux, it can send signals that slow down the heart or cause it to beat irregularly. For people who are already susceptible, such as those with a history of heart rhythm problems or those who have other risk factors for stroke, this can be particularly dangerous. During sleep, when your body is supposed to be resting and repairing itself, these abnormal signals can disrupt the normal rhythm of the heart, increasing the risk of clot formation and ultimately stroke. This is why doctors are so concerned about the interplay between sleep position, acid reflux, and heart health, especially in women who may not realize they're at risk. In clinical practice, we sometimes see patients who come in with vague symptoms, like waking up at night with a racing heart, feeling short of breath, or experiencing unexplained chest discomfort. After a thorough evaluation, we may discover that their sleep position, combined with undiagnosed acid reflux or sleep apnea, is contributing to their symptoms. By simply changing the way they sleep, such as switching to the left side or elevating the head of the bed, we can often see dramatic improvements in their symptoms and a reduction in their risk of serious complications like stroke or heart attack. Ultimately, the position you choose to sleep in each night can have a profound impact on your health, especially if you have risk factors for heart disease, stroke, or acid reflux. While not everyone needs to worry about sleeping on their right side, it's important to be aware of the potential risks, particularly if you have symptoms like snoring, restless sleep, heartburn, or unexplained palpitations. If you're concerned about your sleep position or have been diagnosed with any of these conditions, talk to your doctor about the best ways to protect your heart and brain while you sleep. Sometimes, a simple change in your nightly routine can make all the difference in your long-term health and well-being. When we talk about the risks associated with sleep, it's important to understand that the dangers don't come from a single restless night or an occasional awkward sleeping position. Instead, the real concern is a pattern, a habit that develops over years, sometimes even decades. Imagine the way water, drop by drop, can eventually wear away stone. In the same way, a consistent, years-long pattern of sleeping in a particular position, especially on your right side, can gradually compound with other risk factors you may already have, such as high blood pressure, hormonal changes that come with age, or even genetic predispositions. It's not about one bad night, but about the cumulative effect of many nights, month after month, year after year, that can quietly increase your risk for serious health issues down the road. Recent studies have brought to light a fascinating and somewhat concerning correlation, especially for postmenopausal women. The data suggests that those who habitually sleep on their right side, night after night, are at a higher risk for certain types of strokes, specifically cryptogenic strokes, which are strokes of unknown origin. These are the kinds of strokes that leave doctors scratching their heads, unable to pinpoint a clear cause even after extensive testing. What's particularly striking is that this risk seems to be amplified in women who are already navigating the complex changes of menopause, a time when the body's natural protective hormones are shifting. The research doesn't claim that right-side sleeping directly causes these strokes, but the association is strong enough to warrant attention, especially if you have other risk factors like hypertension, diabetes, or a family history of cardiovascular disease. Now, before you start to worry or lose sleep over this information, let me reassure you, the goal here is not to create panic or anxiety. Instead, it's about empowering you with knowledge, so you can make small, manageable changes that protect your long-term health. My urgent recommendation is not to panic, but to diversify your sleep posture. Just as you wouldn't eat the same meal every day for years, it's wise to avoid sleeping in the exact same position night after night. By mixing up your sleep positions, you can help reduce the cumulative strain on your body and potentially lower your risk of developing problems later in life. Remember, prevention is always easier and more effective than treatment after the fact. So, how can you put this advice into practice? Start by training yourself to sleep on your left side or on your back. If you're someone who suffers from acid reflux or heartburn, elevating your head slightly with an extra pillow can make a big difference in your comfort and health. It might feel strange at first. After all, our bodies get used to certain routines, but with a little patience and some simple adjustments, you can gradually shift your habits. Try placing a pillow behind your back to prevent rolling onto your right side during the night, or use a body pillow to support your knees and hips. These small tweaks can help you stay in a healthier position and make the transition much easier. Why is the left side position so highly recommended? For one, it's gentler on your heart. When you sleep on your left side, gravity helps keep your heart above your stomach, which can reduce pressure on this vital organ and improve circulation. This position also supports better digestion, as it allows food and waste to move more easily through your digestive tract. For people with acid reflux, left-side sleeping can help keep stomach acid from creeping up into the esophagus, reducing nighttime discomfort and the risk of long-term damage. It's a simple change that can have a surprisingly big impact on your overall well-being, especially as you get older. If you prefer to sleep on your back, there are ways to make this position healthier too. Placing a small pillow under your knees can help maintain the natural curve of your spine, reducing strain on your lower back and making it easier to relax into a deep, restorative sleep. This simple adjustment can also help prevent morning stiffness and discomfort, especially if you have a history of back pain or joint issues. Remember, the goal is to find a position that supports your body's natural alignment and allows you to wake up feeling refreshed, not achy or fatigued. Of course, sleep position is just one piece of the puzzle. If you notice that you snore loudly, gasp for air during the night, or wake up frequently with heartburn or a dry mouth, these could be signs of underlying health issues like sleep apnea or gastroesophageal reflux disease, GERD. Both of these conditions can significantly increase your risk for stroke and other serious complications if left untreated. That's why it's so important to talk to your doctor if you experience any of these symptoms. A sleep study can help diagnose sleep apnea, while simple tests and lifestyle changes can help manage GERD. Don't ignore these warning signs. Addressing them early can make a world of difference for your long-term health. Ultimately, the most powerful way to protect yourself from stroke and other sleep-related health risks is to treat any underlying conditions you may have. Whether it's high blood pressure, diabetes, sleep apnea, or GERD, working with your healthcare provider to manage these issues can dramatically lower your risk and help you enjoy a longer, healthier life. Prevention isn't about making drastic changes overnight, it's about taking small, consistent steps that add up over time. By being mindful of your sleep position, paying attention to your body's signals, and seeking medical advice when needed, you're playing the long game, investing in your future health, one night at a time. Remember, your well-being is worth the effort, and every positive change you make today is a gift to your future self. This is a simple, actionable change that can significantly impact your long-term brain and heart health. Please share this vital information with the women in your life, your mother, sister, or friend. For more science-backed, life-saving health insights you can use, subscribe to our channel and hit the notification bell. Your health is your greatest wealth. Let's protect it together.